All right, good afternoon, everybody. I'm glad that you have chosen to join us today. I know there are a lot of people probably going to join us online today as the information we're sharing. And so I want to go ahead and call this meeting to order. We will go around the table to take attendance so that we can determine a quorum. You'll let me know that you're present. Miss Allred?
Here.
Mr. Rivers?
Here.
Dr. McKnight?
Here.
Mr. Peace? Mr. Peace, are you here? Okay, it looks like he's muted. Mr. Udy?
Present.
Dr. Houlihan?
Present.
Dr. McLean?
Yes, present.
Dr. Myrick?
Present.
Miss Day?
Present.
Dr. Winborn?
Present.
Attorney Dubison? Okay, I see you. All right, so we will go ahead and get started. Mr. Udy, would you offer an invocation for us today?
Yes. Thank you, Father. Thank you for listening to our schools. Help us to share together so the world will be a more beautiful place. Come and be with us today and fill our hearts and minds with joy so the decision that we make today will best benefit all of our students, staff, and families. Father, in your name we pray, and all God's people say, amen.
Thank you, Mr. Udy. Miss Allred, would you lead us in the Pledge of Allegiance today?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Ms. Allred. All right, so the purpose of today's meeting, this special called meeting, is to hear information from the staff regarding reentry plans. And so I will first turn it over to our superintendent for her initial comments.
Thank you, Mr. Chair. Good afternoon, board members, guests, and friends. I would also like to thank our elected officials, parents, and community partners who've taken time to join us this afternoon. Today's re-entry opening of school conversation and meeting is designed to provide our Board of Education with some additional data, contemporary survey results, updated health metrics, and real-time district responses to the many questions via phone calls and emails that have come our way as of late. Like many school districts across the state and nation, this is some of the most difficult work that has confronted academic institutions in our lifetime, and our district is no different. As such, this afternoon is designed to assist our board with good information. We have provided insight into Plan B the last two meetings, and will provide more in-depth information into Plan C today because of the governor's announcement on July 14th and the board's ability to be more but not less stringent if interested for health and safety reasons. Now, as superintendent, I am keenly aware that both plans B and C, have both challenges and opportunities for children, educators, and families in our community. But at the end of the day, what matters most to me, just like on inclement weather days, is the answer to this question. Did we do all we could to keep everyone as safe as possible first? That is important. Second, it is critically important that we all partner at a time like this. We partner because for this moment in time, we must take care of everything, academics and safety, with more support, So we are committed to that support, to devices, more professional development. Why? Because we want the quality of service to be just that, of quality. Both plans have remote learning, and today's work is critically important for that reason. There are many specifics in both plans needing attention. And as I have said previously, answers and guidance come forth daily. And our district is committed to keeping our board and community informed. I would like to personally thank our parents and citizens for the outpouring of concern and the questions. We thank our GCPS family members for completing the recent Safe for Reentry survey, and that will remain open until Sunday. I am certain all of us await the day we can safely return to school. I know I do. Learning is optimal when children are in school. So this is the goal, but this must be done safely and when we all have clarity around some questions and concerns. So we hope today's information is helpful and informative for our board and for the public. Mr. Chair, this concludes my opening remarks.
Thank you, Dr. McLean. I want to take just a moment to thank you again for taking the time to come together to have this conversation today. I realize that everyone is busy, and so I'd like to make sure that we spend the time we need to hear the staff's research, recommendations, and plans while considering the options before us in a timely and concise manner. I do not feel that we need to belabor the point today, so we will hear our reentry team's presentation. Then we will give each board member the opportunity to ask clarifying questions you may have or to make any comments. After we've discussed the issue at hand, we will entertain the board as its pleasure if we continue with the current plans we have voted upon or if there are any changes that need to be made to that current stance. While none of us thought we would be having these conversations at the beginning of the year, we have now found ourselves at a point we have to make decisions based on the data that we have available to us currently, while balancing what is best with children and the regulations and decisions passed down to the local level by our state and national leaders. I say all this to remind you, today our goal is to listen to the updated information that will be provided, possibly make a decision as it relates to the opening of school, yet remain flexible in our thinking that things may change, and we hope that they do. We hope that all the factors I've previously mentioned will change to allow us back into our buildings, face-to-face, educating our children. Again, I want to thank everyone who's reached out and given us information in various ways. Your effort and concern is noticed. And with that, we will begin from hearing from the superintendent and her team on their presentation today. So Dr. McLean.
Thank you so much again, Mr. Chair. This afternoon, Ms. Curtis, as our lead, will you please? Thank you. You've pulled up the presentation. Our staff is prepared to share updated metrics and information with you, our board, as you hear information around re-entry for Plan B and C. Next slide, please. We've even put in a modified Plan B for your consideration. I am pleased to announce that our remote learning plan was successfully submitted this past Monday, and I would like to thank the board and our academic team for their work on that document. Now, just as a reminder, several people have emailed, why are we meeting? Next slide, please. According to the North Carolina Department of Health and Human Services guidelines for reopening, school districts may choose to implement a more restrictive plan, but may not choose to implement a less restrictive plan than established by several agencies. I wanted to be certain we were clear with this because several individuals had reached out to board members and myself about a Plan A that is considered a less restrictive plan. But we were very careful, and we are again today, to share with the board, according to these guidelines, board members, and we have Attorney Dubison with us. If there are questions here, she will be available at the end to answer them. You may choose to implement a more restrictive plan, and for the sake of this work, that is Plan C. Next slide, please. Here is the session law, if interested, and we have forwarded this for those who may need it, but we wanted to clear this up for the public and for the board in case there were questions about why Plan A was not on the table. Next slide. Today's presentation will consist of health updates, employee survey results, our current parent survey learning options, remote learning components for both for Plan C and the modified Plan B we will share with you. And that is a hybrid model. It is a conservative, safe way to once again try to establish returning to getting our youngsters back in school. We presented several options for Plan B, and we have now done that today for Plan C. We will be doing that in just a second. We will be presenting options for you to consider for this Plan C, and we are calling one of those a modified Plan B. But we will need your direct. We will also need some more guidance from the Department of Public Instruction and a few other agencies. People have emailed me, Dr. McLean, are you 100% certain? And no, I'm not 100% certain, but we work hard every day to try to get good answers, and some of the answers change. I've asked everyone to remain flexible and nimble because I'm honest with you. Some things have changed. Some things are being tweaked and modified. And so this conservative approach is allowing time for things to get to a more stable place. So we stand ready to direct staff. I stand ready to direct staff, but we still need a little more clarity in some areas. Districts across our state and region are grappling with this very issue because it is that serious for a variety of reasons. There is no perfect or easy answer at this time, nor is there a one-size-fits-all. But I promise you, we're taking everything as seriously as we can, and we are working as hard as we can. So this afternoon, I am pleased to begin the presentation with two guests who are experts in their area. I'm delighted to have with us for the health review, the COVID-19 data review in the area of health, Lisa Harrison, who's the director of our health department here in Granville Vance Health Department, and Dr. Shauna Guthrie. So I turn the presentation over to the both of them at this time.
Thank you, Dr. McLean. And I'm so delighted to be with you today as your local health director and echo Dr. McLean's thoughts about the importance of health and safety of our children and our staff in the school system, as well as the acknowledgement that we are still learning a tremendous amount about COVID-19 and the way this virus works in individuals and in communities. So our job in public health is to take a look at all of the data and try to make decisions the best way we know how based on the science that we know. And it is still evolving. So thank you for that acknowledgement that we will continue to plan, do, study, act, and implement the best that we know at the time, and know that it can continue to change. I need to acknowledge that although I'm channeling Dr. Guthrie every day and all of her wonderful, wonderful guidance for us here in Granville and Vance counties at our health department, she is with patients right this second, and we've had an interesting challenge this afternoon that needs her attention. So I'm hoping she can join me, but otherwise know that I will channel her and that I will send questions back her way if you have them for her. Next slide, please. So across North Carolina, you can go to the Department of Health and Human Services and click on any county in our state to see the rate of infection from COVID-19 and the raw numbers of the cases that we have. I invite you also to go to our website at granvillevancepublichealth.org. We have a COVID-19 page. We update daily with our local numbers in both of these counties, and we also send out daily emails with numbers. If you would like to sign up for those at the bottom of our COVID page, you may, so you too can follow along with what we're seeing in community. As of yesterday afternoon at 6:30 p.m., we had 1,059 positive test results for COVID-19 in Granville County. 553 of those are community spread. 492 of those are affiliated with the Butner Correctional Complex. So you can tell that more than half of those over 1,000 positive cases of COVID-19 are across our entire community and not just in Butner, North Carolina. Next slide, please. I have a series of slides now that show you our cumulative cases of COVID-19 over time and what we at your local health department have been managing as far as individual positive cases and contact tracing with those who might have been within 6 feet for more than 15 minutes of each positive case that we get a result on. Your local health department receives results on every positive case of COVID-19 regardless of where people are tested. People could go to Durham, Raleigh, or Chapel Hill and get a COVID test, but if their residence is Granville County, if their home address is here with us, then we at the Granville Vance Public Health Department receive those results and are charged with communicable disease response to ensure that we are trying to detect and isolate and prevent the spread of COVID-19. So this graph shows you all cases, our total cases in Granville County as of July 17th. So I can already tell you we have 50 more than that in our total Vance cases. Next slide. This also lets you know that we have a number of outbreaks we are concurrently responding to and staying in touch with. That includes the prison in Butner, that includes long-term care facilities across Granville and Vance counties. And we have worked closely with hospitals and state hospitals and other residential facilities that care for people who need to be in a residential facility. And we're making sure we're following those cases and preventing infection where we can. Next. The next few slides will just show you the new cases by week. And so you can see different surges that we've responded to. A lot of times we will have, when we do have outbreaks in either a long-term care facility or in any of our Butner facilities, they are really good about working with us to do a lot of testing at one time. So when you see those spikes and those peaks in this data over the weeks, that's usually when we do a response to an outbreak and we get a large number of results back at one time. Next. The next few slides have some demographic data to share with you the number of cases we have by age category. So even though we do know children are not a very common reservoir for COVID-19, we do know that we have seen COVID-19 in children, and that represents about 12.5% of our population in the district. As you can see, the large majority of those who have positive COVID-19 tests in our district are between the ages of 20 and 44. And then we have a pretty even distribution across the next series of age groups. Interestingly, we do not have a lot of cases come back in the age group over 85, but that is where we see a majority of our deaths. So continue on with the demographic data for me, and we'll take a look at what's next. We do know that exactly 63 children in Granville County, which represents 6% of the population, have been positive for COVID-19. Oftentimes we'll see the transmission of COVID-19 happen in families within households because it is hard to isolate if you are in a nuclear family living under the same roof and sharing a lot of the same space. Next. And you can also see the age breakdown for staff of Granville County Public Schools and where staff live. So it's very common for many staff across our agencies in the district to live in other counties than Vance and Granville. And so we don't just need to pay attention to our local rates of infection and what's happening, but also other areas close to us. And that is the same for the cases of staff members of long-term care facilities where we've done a lot of work. This looks very similar. You can see the age breakdown of the staff there. And I do want to point out that the large majority are between the ages of 50 and 64. I'm sorry, between the ages of 25 and 49. The next group that's the largest is between 50 and 64. 6% are over age 65. Okay, next. Next.
I think that's it. I think Dr. McLean, do you want to open it, or Mr. Richardson, do you want to open it up to some questions about the data?
I believe at this point we were asking board members to hold their questions until the presentation was over with, so that we could kind of keep everybody focused.
Okay.
That concludes the medical component
Mhm.
of the presentation. Thank you so much, Ms. Harrison. We will now move to the survey results, and I present Ms. Curtis to pick up here.
Thank you, Dr. McLean, board members, and again, thank you, Ms. Harrison, for sharing that with us today. At this time, I'm going to give you some updates on some data we've been collecting from our stakeholders, so both our families and staff members, about how we need to re-enter school. So the first piece of data I'm going to share with you is we've asked families to complete the sign up for fall entry, or SAFE, and we earlier this summer surveyed just kind of preferences, but at this point we need people to make a commitment about how they want their child to enter school beginning August 17th. So for those of you in the community, remember this is open until the end of the day on Sunday, July 26th. So if you haven't filled out yet, please do. So one of the biggest question we're asking every family is, which learning option do you choose for your child for the 2021 school year? And as board members, as you recall, we are offering 3 choices for families. The first is blended learning at their base school. And as you recall, that is face-to-face learning 2 days per week and remote instruction 3 days per week. And we have about 46% of our families that have selected that thus far. Option 2 is our virtual option at the base school. So again, they're still being served by the teachers that teach at their school, but they are doing all of their instruction in a remote environment. And the last option is our blended learning school that already existed here in Granville County, and that's Granville Academy. We've had about a little bit more than 4% of our families have selected that. Just as a comparison point, we did survey, as I said earlier this summer, parents, and ask, what would you prefer? And now we're looking at what we are committing to. We've seen a lot of change in that data. So earlier this summer, beginning of June, we surveyed parents, and option 1, blended learning at the base school, 54% of our parents selected that. Today, we're close to 47%. The virtual option has really exploded. Earlier this summer, 28% of our parents preferred that, but we've asked people to sign up in the last week. 49% of our parents have selected that. And Granville Academy, again, that's a blended option as well, where students are part-time face-to-face. Almost 16% preferred that in June, but as we are asking folks to sign up and commit, we're at about a little less than 5%. So the preferences that we're seeing from our parents at this time are more for the virtual option, and fewer folks choosing that blended option than we saw earlier this summer. We also have surveyed our teachers and staff. And again, we've seen some changes in that area as well. So I'd like to give you a couple updates on that. Again, at the beginning of June, we surveyed teachers only, and we asked them if was your preference for returning to school in the fall. And so at the beginning of June, our teachers indicated they were more interested in blended learning, a mix of in-person and remote instruction. 72% of our teachers selected that at the time. Only 27.8% of our teachers selected all remote instruction. Since then, last week, we surveyed all employees, and I've got it broken out for you here. We've seen a big shift in what our teachers and staff are feeling. So while at the beginning of the summer, there was a preference for blended learning, now the majority of our staff are feeling more comfortable about participating in all remote instruction. We broke it out by all employees and teachers only because we wanted you to be able to compare the original survey to the survey we just did. So if you look at the first and third columns, that's just teacher data. but the all employees data is nearly identical to the teachers' data. So we've included both data points for you.
Ms. Curtis, will you read the numbers, please, for our board members who have called in?
Yes, ma'am. I apologize. Yes. So in June, our teachers said 72% of them wanted a mix of in-person and remote instruction, so blended learning. Right now, our teachers are saying 44.6% prefer the blended learning. So we've gone down quite a bit in that area. All remote instruction, we had 27.8% of our teachers in June indicating that was their preference. Now their preference is 55.2% for all remote instruction. We asked one other question of our staff last week. If in-person learning resumes in the fall, how comfortable are you returning to work? As you can see, we have a lot of discomfort with coming back into the building. There are lots of reasons why that might be amongst our staff. It may be their own personal health concerns within their family, or concerns about the safety measures that are in place. And we understand all of those are important to them, and wanted to give them the opportunity to tell us how they were feeling about returning to in-person learning. So that's just a little bit of the breakdown for that. Again, we had about, I apologize, I don't have my percentages on here. We had more than 50% of our staff indicating they had some level of discomfort in returning to school. Now, I'd just like to remind you, our 3 learning options are, again, option 1, blended learning at the base school, option 2, the virtual option from our base school, and option 3, Granville Academy. And we wanted to take just a second to show you this graphic and tell you a little bit about how they would look different under Plan B and Plan C. So option 1, blended learning at the base school under Plan B, we're all familiar with this, face-to-face instruction 2 days per week, remote instruction 3 days per week. We are expecting to have, well, we will have Chromebooks for every student this year, K-12, but if families don't have internet access, we will have paper packets available if they need them on remote instruction days in this model. We're also going to be working with our teachers and families to be sure they understand how to use the offline option in our Chromebooks, so they can do their work on their Chromebook, bring it back to school, and as soon as they hit our network, their work is turned in and uploaded. Under Plan C, these students would be full-time with remote instruction. Again, same as under Plan B, paper packets would be available, or we would work with them for the offline access if they didn't have internet. Option 2, the virtual option at the base school, is the same no matter what plan we operate under this year. Plan A, Plan B, Plan C, those students will be working full-time at home for the entire year. So it's an option for stability if families are interested in knowing for sure what it's going to be like from day one. Option 3 is Granville Academy. Again, those students are face-to-face 2 partial days per week and have remote instruction 3 days per week. That's their model in Plan A and in Plan B, because that's their model every day when we're not in this environment. Under Plan C, however, they would have full-time remote instruction. So we just wanted to make sure you would know the difference between what the 3 options look like under Plan A and Plan C. Just a reminder of the model you approved for Plan B for blended learning at the base school. Group A would come face-to-face Monday and Tuesday and be remote Thursday and Friday, Wednesday, Thursday, and Friday. Group B students would be remote Monday, Tuesday, Wednesday, and face-to-face Thursday and Friday. Okay, and we're doing this here or at the end?
Go now, please, dear. This is the new slide.
So board members, we sent you before the board meeting today this slide to indicate some options for you to consider. So if you'll take a look, we want to keep a couple of things in mind no matter what we choose. In order to take every precaution for our students and staff, we're going to review our data and work in partnership with the health department and reassess plans and pivot as necessary. One option for you to consider is that granting the superintendent the authority to move faster or slower, depending on COVID-19 metrics or trends. We are considering, once we feel that, or once it is determined that it's safe to do so, that we may bring some populations back first. So we would work in consultation with our EC department, our EL department, and the health department to make sure that we are serving some students that may need some specialized supports coming back sooner. These plans slow down the return of students, but the plan with both of these is for them to return to school when it is safe to do so. So you have approved our existing Plan B. We want to provide you with two other options to consider. The first is our modified Plan B that Dr. McLean mentioned. In this plan, weeks 1 through 5 would be full-time remote instruction. Week 3, so in the middle of that window, we would reassess and see where we are. Weeks 6 through 9, we would begin a staggered entry where students would come 1 day per week. So we've talked about earlier this summer. Again, if it's determined that it's safe to do so. And then the plan would be, again, if it's safe to do so, to return to Plan B in week 10. So that is kind of a 9-week kind of slow movement back into Plan B. Plan C would be another option for you to consider. That would be weeks 1 through 9, full-time remote instruction. And about the halfway point in week 4, we would reassess and determine if it was safe for us to return at that point. Again, you can grant the superintendent the authority to do that, move faster or slower, depending on the metrics and trends and consultation and the consultations we make with the health department. The other thing to remember, as I mentioned earlier, is this only applies to students enrolled in the blended learning at the base school or Granville Academy. Students enrolled at the virtual option at the base school will not be affected. They will be full-time remote the entire year, no matter what plan we are in. So at this time, we'd like to share some things about how we will meet student needs in Plan C, if that is what you choose to do today. We looked at the parent data that we received earlier this summer about at-home learning in the spring, and we wanted to address many of the concerns that people had and improve over what we had to do in an emergency situation. So we're going to share some things that are going to be a little bit different this fall. First, we know that our families need help with social emotional learning and mental health. So we want to provide supports for students, families, and staff. We are looking at what we're going to provide for all people at the core level. At the supplemental level, we want to provide some small group supports for students, families, and staff. And at the intensive level, our students that are most at risk in this area, what are some individualized things we'll be doing for those students? So we've developed plans, again, for those 3 groups at those 3 levels. At this time, I'm going to turn it over to Dr. Myrick, and he is going to talk to you a little bit about professional development.
Thank you, Ms. Curtis. I'm going to defer to Ms. Robinson, who will talk through our professional development just a little bit, and then I will come back on after that.
Good afternoon, everyone. When we think about getting ready for remote teaching and learning, we know the importance of ensuring all of our teachers have the information, the knowledge, and the skills they need to teach in a remote environment. This past spring, our teachers jumped right in and did a great job, even though it was new for many folks. So we want to make sure everyone feels equipped to provide high quality instruction that results in student learning, no matter the context, whether that's on-site or online. Our teachers know how to teach. So what our work then for professional development is to help them see how what they know transfers to a remote environment, and then what are the additional tools and strategies they need to work in a virtual setting with students. So our work will be providing quality PD around a range of topics using a step-by-step approach with options for teachers. It starts with step 1 of building that foundational understanding of remote teaching and learning. We have already sent links to these 2 courses out to staff members so they can go ahead and get started on that in the summer. Then step 2 is defining and clearly articulating to our teachers our local expectations. what are our Granville County expectations for remote teaching and learning? And there are 2 PD opportunities related to that one. One is all of our students will have Chromebooks, so ensuring our teachers are clear on how to help students with their Chromebooks. And then we are in the process of building PD on remote teaching and learning in Granville County Public Schools, where we will articulate our local expectations, what we submitted in our remote instruction plan to DPI. Step 3 is setting up your virtual classroom. We know if we're in a remote environment, teachers are going to need a virtual classroom space. And so this is something they can go ahead and be working on now. These modules are already available, have been available in the district for quite some time. Lots of our teachers took advantage of them in the spring. And so those pieces are already in place. And then the last piece is once you're ready to start planning instruction for a remote environment, we want to have in the moment learning opportunities for our teachers for the tools that they need to design good instruction for a remote environment. So we have some larger courses, 2-hour courses, and then we'll have some smaller bite-size, I need information very quickly in the moment tutorials for teachers to take a hold of when they need them in really quickly. All of this will work together to equip our teachers to provide quality academic experiences for kids. As I said, the majority of these modules are already available, and teachers are taking advantage of them even through the summer months. And then once teachers are back in August, we will intensify that work. Dr. Myrick?
Thank you. Next slide, please. So we are going to also be providing contingency plans for our students who are in our Exceptional Children's Program. They will receive their services, but it might be modified or will need to be modified if we are under Plan B or C. Also, the specially designed instruction services will be delivered according to mutually agreed upon times in the contingency plan for remote learning. So I do want to say that we will take care of our EC students, our students with an IEP. Next slide, please. Our next group of students that we will definitely be focusing on are our English learners. And our English learners will receive services based on the approved language instruction education program by the Department of Public Instruction. And this kind of gives you a quick overview of what that might look like depending on which area our students are falling in, whether it's comprehensive, supportive, or the transitional phase. Next slide, please. We understand that there are some families who do not have access to the internet, and we will need to provide paper packets at the base school. And so we will set aside a day of the week. More than likely that day will be Thursday, and teachers, and parents will have an opportunity to pick up those packets between the hours of 11 a.m. and 6 p.m. Of course, if that is inconvenient for a family, they would just need to contact their child's school, and the principal can set up some arrangements for them, hopefully to get that information to them. We will also be using our district Wi-Fi would be available to all families at all of our schools. You just simply pull into the parking lot, and for our Chromebooks, as long as it's accessing a wireless network, that work will be able to be uploaded. And there will also be some recorded lessons that will be available. Next slide, please. So this next slide, I'm going to ask Gwen Lofton, our technology director, to kind of give us an update. We have found out some great news just this week, and we definitely want to make sure that our families who are listening today have that information. Ms. Lofton.
Sure, thank you, Dr. Myrick. So we wanted to give an update on where we are with devices. So in terms of when we plan to distribute our devices, we don't have a specific date for our K-2 students, as we are still waiting for those devices to arrive. As you can imagine, all of the districts are in the same boat as us, and all of us are trying to order devices at the same time. So we don't have an arrival date for those yet, so that's still to be determined. But the rest of our grade levels have been secured and will be ready to go by the start of school for sure. So 3rd through 5th grade device distribution dates will be the week of August 10th through 14th. The same goes for 6th grade. And then our 7th through 12th grade students already have their device from last spring, so they will be able to continue to use that device for the start of the school year. As Dr. Myrick mentioned, we're super excited that we were able to secure through some federal funding 260 Wi-Fi hotspots that we will be able to distribute to staff and students in our district who do not have internet connectivity. These MiFis will run on cell towers. We're looking at getting ones that work with Verizon, as that tends to be the best cell coverage in our district. They come with 12 months of unlimited data, and we are very excited to have secured a vendor for this and begin using these in our districts to make remote learning accessible for many more of our students.
Thank you. Next slide.
Excellent.
Our parent liaison in the county will be creating a calendar of live sessions, recorded events, and printed resources for parents to support them in this remote environment. And some of the supports that parents can expect to see will be tech support, social and emotional and mental health supports, health and safety education, and as well as some academic supports. And we heard loud and clear from our families from the spring that they needed some assistance with some things that we were asking our students to do. The children knew and understood what to do because they were using those devices every day in the classrooms. But our parents were saying we need some help and support too. So we are very excited that we're going to be able to offer this to our families moving forward. Next slide, please. Thank you.
Good afternoon, board members. Yes, thank you, Dr. McLean. This is Stan Winborn. Mr. Perry and I are available to answer questions afterwards about any staffing concerns, but we do know that we have certain classified positions in the district that are not dual employees that could be impacted if we shift to Plan C. We have approximately 30 bus drivers who that is their only job. We also have 80 child nutrition workers. And so depending on what the board decides today, we would need to find alternate work assignments and shift the duties of these folks. There will be plenty of work to do. We believe that we could easily use them as health screeners, preparing packets, prep and meal delivery, many of the things that we did this past spring. So we are confident that we will be able to keep all of these folks on staff and plenty of work. Next slide, please. Also, under Plan C, we would ask the school-based staff to actually physically come to school on remote instruction days. That would provide that sense of working together and help them be a little bit more coordinated in their efforts. We would be following the careful screening protocols and guidelines for all of those staff that would be reporting physically to work each day. And as Dr. McLean has mentioned, she is very interested in trying to find ways to support our staff members who have school-age children on those days, since they would not be going to school in our district. But again, looking at various options, trying to navigate the regulations and options that exist. And I know she's been in consultation with our board attorney on this matter as well. Next slide. And I think I'll turn it back over to Dr. McLean.
Thank you so very much. I'm going to sort of close the presentation out, just highlighting a few of our priorities. I'd like to thank everyone for their work on the presentation and for just the important components. Number one, safety for our students and staff remains our top priority, and that is for our facilities and on the buses. The regulations are very clear concerning our facilities and the school buses. That being mentioned, we may need to and are investigating this monitor component for buses if we go with Plan B. So there are still pieces when I say we have questions that need answers and possibly even some funding. Those are the types of things we're talking about. Equity for devices, equity in general, i.e. devices for all students. Our excitement about Wi-Fi this time, that's something that's hot off the press, just happened yesterday. We hit the button yesterday. We're thrilled about that. That's something we did not have before, but we're thrilled. We still need some help with internet in our community. So we're willing to have those conversations, and we're going to, because we want all of our students in our community to have the access they need. So regardless of the plan, because remember, we have to remain fluid. We don't know what the metrics will say at any given time, but we know we want to be prepared, and we want the things our children and teachers need. We want everyone to have what they need when they need it. Student learning is a top priority for us, and the professional development and family support goes right along with it. Whether we're on Plan B or Plan C, meal service will be available. We have to work out the intricacies for which plan it will be, and once we know that, we're continuing to apply for and to work through which plan will be appropriate for the plan selected. We're going to continue to investigate and work closely with our health department for any of these decisions. Some people will ask me, Dr. McLean, which one do you want? And I need to be very clear. This is not about Dr. McLean's personal decision. It is about what do the metrics say and what is best for our district based on the data. And you've seen a lot of data today. So please know, we hope we've provided some quality information for consideration. And we hope we've done that every time for Plan B and now for Plan C for consideration. We promise to continue working with our community partners, child care facilities, our elected officials, so that we can do whatever is necessary for our school system together. I tell everyone, I had the opportunity to speak with our family the other week, and I said, we're all in this together, because I truly believe we are. We're all in this together. Mr. Chair, that concludes our presentation this afternoon, and I turn it back over to you.
All right, thank you, Dr. McLean. Thank you, the rest of the staff that put all that together for us as they've been working to do that. So as I said in my open remarks, kind of the way we will lay this out is we will go around the table. This is an opportunity for board members to either ask clarifying questions. If you'll ask your question, we'll get the appropriate staff member to answer that. And then at the end of your questions, if you have a comment, just kind of maybe where you stand or anything like that. I do want you to remember, I don't want to limit us, but I also remember that there are 6 other board members. And so we want to make sure that everybody has time to do that. And so if you are ready, again, after we finish that, then we will come back and discuss if we need any further information to make a decision, or if we're ready to make a decision at that point. So I will start like we do usually. Ms. Allred, do you have questions and or comment?
I have a few questions. In the modified Plan B that was presented, I believe it was stated that there would be certain populations that would be started first. And I'm not sure what that means. Which populations would be first?
Yes, we have reason, based on research, to want to take a look at some of our younger children. Of course, we want to continue researching that some of our pre-K, you're always interested in those young readers, those early grades, first grade, second grade, kindergarten. So we're continuing to investigate that, Ms. Allred, but looking at some of our younger grades, we're also very much so interested in looking at some of our self-contained classes and some of our populations of concern. And I put it that way because we're continuing to research. But there are some groups that have caused us pause, and then there's some others where we just think it's a great idea based on research, where for health reasons might not cause as much risk. I'd like to ask Ms. Harrison at the health department if there's anything she may want to add to that. I know the research changed in this area as well. Again, we won't do anything without the health department on that decision as well, Ms. Allred.
Okay, thank you.
Yes, ma'am.
And another question that I have is the additional hotspots that you're talking about for the remote learning. And I've said this several times in our meetings. Up in District 1, there is so little connectivity in our area, especially in Oak Hill community and the northern part of the county. The hotspots, how would they affect these children?
Do you mind if I chime in here?
Thank you, Gwen. Please do.
Sure. So we're trying to work the best we can with our situation. So you're exactly correct in that the MiFis depend on cell towers. So if it's an area that doesn't have good cell coverage, unfortunately, it's not going to be a solution that works for them. So as you heard mentioned in the presentation, we do have the option of paper packets, as well as Chromebooks can work offline, where the students can download the information that they need, work on it at home offline, and then when they reconnect to our network, or any network, it will sync. So you're right, the MiFis aren't going to work for everybody, but we're hoping it fills in the gaps for those who do have cell coverage but not internet connectivity.
Okay, thank you. And I've got one more question, if you'll bear with me. One of my main concerns is Plan B, the transportation issue, the kids on the buses. Are we required to provide transportation? And can we eliminate bus routes? Is that an option at all, or is that something that we have to do?
Dr. Winborn, will you take that question for me?
Yes, ma'am. So yes, I believe that we are required to provide bus transportation, and Ms. Dubison could probably cite the legal framework for that. But you have identified an area that we are still waiting for much guidance on. We've gotten some contradicting information and some advice that can make it very, very labor intensive to transport students using our buses. As Dr. McLean mentioned, we may need, if we have to screen every child before they get on the bus, we would need to have an additional adult on each bus. The driver would not be able to safely do that process. So we would need to have we would need to pay for another person, another adult, to be on the bus to do that. Also, there's lots of questions about if there were younger children at the bus stop in the morning waiting to get picked up, and what if they didn't pass the screening and there was no parent or guardian there? We certainly would not leave that child on the side of the road. So we would have to then, make a provision to put them on the bus, have them socially distanced, which would then impact our capacity on that route. That's another difficult situation. Fortunately, we do have that Here Comes the Bus app, which we're going to strongly encourage all parents to use, which will help them with tracking it. But you have identified one of the bottlenecks in this whole process. The bus transportation it's quite difficult to get a solid plan in place.
And just to clarify, that the charter schools don't have to provide transportation, correct?
That is correct.
That's correct. That is one of the regulations that charters are exempted from.
Okay. Okay,
Ms.
thank
Howard,
you. That's my question.
Any further questions or comments?
I'm done with my questions for now. Thank you.
Okay, thank you. Mr. Rivers.
Thank you, Mr. Chair. A quick question for you first. Are you just looking for our questions right now? And when we actually start deliberating whether we're going to go with Plan B, modified Plan B, or Plan C, will the board then be allowed to discuss and offer comments? I don't want to. I'm happy just to ask questions right now, and if we're going to do that debate later, then I'll reserve my comments for that time.
Yes, sir. So now's time for questions and just general comments. Following the procedures of how we will do, we will then ask for a motion to be put on the floor, and that's when we'll actually deliberate that particular decision.
Okay, so there will be deliberation at a later point in this meeting.
Yes, sir.
Okay, thank you so much. All right, like Lynn, I had a couple of questions, and I appreciate her questions. I'll just go down my list here in no particular order. And I guess this is for Dr. Myrick. If a parent chooses remote learning, in other words, I believe that's option C or plan C, whatever it is. If a parent chooses remote learning, are they compelled to remain in that program the entire year, or can they elect to go to the blended, or if we go to plan A, back to the face-to-face, say in November or December or whatever?
Thank you. The plan that you are referring to now, Mr. Rivers, I believe it's in Plan C, and that's part of the SAFE survey that we have sent out to all of the families. If a family chooses to have virtual at their base school, that student will be required to remain virtual for the remainder of the school year.
Okay, my comment would be, I think we might want to rethink that. I do not believe the remote learning is going to be nearly as effective as face-to-face, and I'm afraid if parents become more comfortable with face-to-face after we're doing it for some portion of our students, and they are now in the remote learning, they may want to move to full-time, especially if things develop where we can go to say option A from the governor. So anyway, I would just make the comment that I think that needs to be considered. I think parents may regret having made that decision, as things, change for the better. My second question is, how are we going to address the emotional needs and the mental health needs for our students with only 2 school social workers? What's the plan? We know, and there's been multiple studies from pediatricians and the American Pediatric Society and the like. There have been figures as much as 30% of children in this isolated situation are now depressed and have increased mental issues. We know we've had mental health issues before COVID ever hit us. So, and we know we didn't have enough social workers. So how are we going to deal with children with severe mental health and emotional needs in a remote learning environment?
Ms. Curtis, and I believe Dr. Pauletta Thompson is on the call. We have done some recent partnering with a group to try to help us do some embedding of assignments. Will you ladies take a stab at that question, please?
Yes, ma'am. Thank you. Mr. Rivers, one of the important things for us to remember is that the social and emotional well-being of our students is not the responsibility of just 1 or 2 folks in our districts. That's the responsibility of every person that works in all of our buildings across the district. And so when we were talking earlier about core supports, that's what every person in our district is doing with all students at all times. And so we've identified some practices that we're going to train teachers, counselors, office staff on. We've got a company called Panorama that we're contracting with to help us educate our staff both at the beginning of the year and then throughout the year on how to teach the skills that we want children to build. But we know that there are students that have more severe needs. And that's when we got to the top of that screen and it talked about intensive needs. That's where we partner with our local mental health agencies, and we have both school-based mental health, where kids can get services face-to-face, individualized services face-to-face while they're on our campus. And if we are in remote, those same services are offered through teletherapy. And our social workers kind of act as case managers in those cases to help give a kind of wraparound services to those children and those families to ensure that they have all the things they need, because oftentimes the mental health issues that they're experiencing are, there are other things that are contributing to that in their home environment and in the school environment. So we've got those school-based, those school social workers that are working to provide those case management services. So that's, it's just kind of a broad range, because there's the things we do for everybody. There's the things we do for kids that have similar needs that we can group together and serve on our school campuses for a short amount of time. And that might be done by a counselor or teachers in the building. And then there are kids with those more intensive needs, and they get those individualized one-on-one services. So I hope that answers your question. But again, I would just say it's important to remember that every one of our staff members is responsible for supporting the social and emotional well-being of our students, not just our two social workers, because you're right, no, that they're not superhuman. They would not be able to do that.
Dr. McLean, may I speak? May I address the social worker question?
Absolutely.
We do have, Dr. Thompson has secured a grant, and we're waiting to advertise for another social worker position. We do have that position that will give us one. And I'm working with the ladies from Project Arrow on a 3-year grant that would give us an additional social worker and 2 assistants. And we're very hopeful that one will pan out. That one will be a $1.6 million grant if granted.
Thank you, Dr. Thomas.
So Dr. Thomas, if all that pans out, how many total school social workers would we have if we get all the grants and everything that we're trying to do for this coming year?
That would give us 4 social workers and 2 part-time or 2 assistants for mental health.
Thank you. Thank you. Ms. Curtis, getting back to you, what I'm wrestling with on the remote on Plan C is if the children are not in the building, if they're not at school, you and I both know that the teachers often identify children that are going through a crisis. Obviously the mutilations is quite apparent to a teacher or a counselor. If the children are remote, if they're not in school, how are we going to identify some of these issues? What is the risk we're running by isolating these children and not allowing them to socialize and get the emotional support they would get by being with their peers in a school environment?
I think that's a great question. So we're preparing to have our staff check in with students every day, because we know that that's and when we aren't able to reach students, or we identify a need through our check-ins, then that escalates students up the scale. We have a crisis response plan that we'll be following if we have students that present suicidal ideations, present with those self-mutilation cutting behaviors that you're discussing. So we have those processes and procedures in place to keep kids safe. It is certainly more challenging in a remote environment, and that's why we want to provide and are going to provide some additional training to our staff to be sure that they're able to recognize those signs and respond appropriately.
All right, thank you. I really appreciate that. I have 2 quick questions for Ms. Harrison. We've had 3, according to Dr. McLean is wonderful at sending out the daily health department briefings. I think we all read them very carefully. According to the most recent one that came out that was emailed to us today, we have had 3 community COVID deaths in Granville County. Do you know how many seasonal flu deaths we have had this seasonal flu season?
Oh, that's a great question. I will have to look that one up. I don't have that one committed to memory given all of COVID in my head right now, but I'm glad to look that up and send that to you. Typically, it is in the thousands for the state of North Carolina, but I'll need to refresh my memory on local numbers. And typically, we see those spike more in the fall and the winter. So I'll be sure to get that number out to Dr. McLean to share with you all.
Historically, has it been greater than 3?
It has varied greatly depending on the strain of flu that we see. And I'll just have to take a look at those numbers and share that. I can share the trends over time with you for our local area.
All right. Nationally, looking at, especially if you go on websites for the various states for their public health departments, you see a substantially greater number of mortality rate for seasonal flu than for COVID, and actually gross numbers are exceeding the COVID deaths. So I was just curious as to what it is in Granville County. My last question: there have been many studies. I've read a lot of them from South Korea, Ireland, and Iceland. Among others, from New York City Department of Public Health, that have shown little or no transmission from the COVID virus among children, between children, and from children to adults. What are your thoughts on that?
Well, I do think it is consistent with some of the guidance and information that we're hearing in the United States, that we are hopeful that data will be true here as well. I think the interesting thing that we all admit to is that we're still learning so much, and inside a closed area where transmission can happen more easily, there's just still a lot we don't know when we get higher numbers of people together. We do see a fair amount of transmission in a household. And so, I do think that when people are vigilant about wearing a face covering, staying more than 6 feet apart from others, and washing hands frequently, we can greatly reduce the chances of transmission. And it's our responsibility to make sure that everyone in our community is doing that well, so we can get kids back to school safely. But I do think we have some risk for those at-risk populations who are over age 65, who have chronic disease, and especially those who suffer from diabetes on the staff would be the ones I'd be most concerned about at this point until we know more.
Certainly, and I appreciate that. You mentioned there were thousands of deaths in North Carolina each year from seasonal flu?
Correct.
And what's our current death toll, tragically, our death toll from COVID in North Carolina as of today?
That is exceeding, let's see, I will look that up very quickly and get that number as of 11 a.m. today.
Hey, a lot of us have questions to ask too.
Excellent. Well, we can certainly keep going, and I will make sure that I give you that latest number. The deaths are 1,726 as of today.
So 1,076 as of today in North Carolina?
1,726, 1,726.
And then seasonal flu has thousands, but you'll have to get those numbers. All righty. Thank you so much.
And there are 1,188 currently hospitalized, and typically we see about 50% of those who are hospitalized with severe illness not make it out of the hospital.
Great, thank you.
Mm-hmm.
All right, is that the end of your questions, Mr. Rivers?
Yes, it is. And I'd just like to comment to Dr. Houlihan, this is an extremely important decision we're going to have to make, and it may take us some time to get all the information we need.
Okay. All right. Thank you, sir. Dr. McKnight, do you have questions or comments?
I do, and I'll be brief here. Just to follow up on one of the questions Mr. Rivers asked earlier about parents being able to switch between plans. Is there some particular legal reason or staffing issue which would prohibit, parents from being able to switch if metrics improved?
I'm going to defer to Dr. Winborn on that one, because some of this is dependent upon the staffing that we have to do, I believe. So Dr. Winborn and Dr. McLean, I think you may be better to answer that than me.
Well, I know that this is Dr. Winborn. I know that has been a topic of conversation. I believe that the decision to ask for a one-year commitment was indeed due to staffing assignments that we would need to make. However, I think the point that that you made, Dr. McKnight, if things improved and we transitioned back to a plan A by spring, and there were parents that wanted to come back to school full time, I'm sure that we would try to make that accommodation. I think what we were attempting to do is establish a commitment, so there wouldn't be this movement from virtual back to blended, back to virtual, back and forth, which would wreak havoc with our teaching assignment schedules.
Gotcha.
But I think that's something that we can certainly explore.
Okay.
And I'll add to that, Dr. McKnight. We can certainly explore it. I'm sorry, it's thundering up a storm here and lights flickering. We certainly can explore it at the semester mark, particularly for high school students who are on semester courses.
Okay.
That is something that's extremely important. So where we've asked for year-long commitment, so our teachers would know what to do, and for employment purposes, we want to be really careful that for our high school students in semester-long courses, or on that 4x4, where they are finishing an entire course in a semester, the fluidity would pose some difficulty there. But we certainly can put that down as something we're willing to go back and revisit.
Okay. I've received a lot of correspondence and I've read a lot of stuff about how concerned people are about this social interaction piece for students. And do you guys have any idea of what social interaction will look like in the school moving forward? Because I'm just trying to help, I guess, some of the folk who are listening get an idea that it's not going to look pre-COVID, but what do you guys envision social interaction looking like in the schools?
Well, let me see if I can help with at least the mask covering piece, which was a big topic yesterday at a meeting I attended virtually, at least as it pertains to face coverings. And this is whether youngsters are inside or outside. They will, students, staff, everyone will need to be in masks, except if in fact a face mask break is built in. And again, I'm sorry. Again, this is following guidelines, and we will have to follow guidelines. A break will need to be built in, but everyone will need to have on their mask unless they are eating or drinking. They will need to have on their mask, even if they are outside on the playground, even if they are, apart. So you're right, the social interaction piece is a little different. And I believe that's a big deal because figuring that out is new for all of us and different. But I thought that mask piece, when I saw the inside or outside piece, that alone is different. And helping people figure it out will be something new for all of us. So I don't know if that helps you or convolutes it or makes it a little muddier, but that was something once I realized in that conversation, my goodness, this is new, because I had some people say, well, at least they won't have to wear masks outside. Yes, they will have to wear masks outside.
And are we considering eating lunch in the classroom or going straight to homeroom in the morning? Like, I don't foresee kids being able to congregate in the gym like they used to before the bell rings, but
there will be no congregating in the gymnasiums or the cafeterias.
okay.
There is no congregating. We will have to be able to have very clear locations based on the guidelines again of where our students are at all times.
Okay. And my last question, I'll just throw this out there for anybody, but are any of you familiar with or seeing any research around, I guess, children in the U.S. who have been put in a position to facilitate widespread transmission? I just find it kind of hard to lean on some of this data when all of the kids went out of school in March and kids really haven't had the opportunity. So I was looking for some research to maybe kind of go with that, but I haven't been able to find anything. if anybody's familiar with that.
Ms. Harrison, can you help us with that?
Yeah, so we have a whole compilation of research that our state health directors has shared with local health directors and put together. I will share this with you. It's a lot of the strong schools in North Carolina information, but we do know that younger children are less likely than adults to have COVID-19, but we also are just a little concerned about the potential transmission from children to older adults. I think that's one of the main concerns, and we have a number of references. I have a whole page of references that I will forward to be in your inbox by this afternoon, so you can see the one pager of data and information that our state is providing along with the Stay Strong North Carolina. And since I was able to look up the data Mr. Rivers asked about, let me share with you that in North Carolina during the 2018-2019 flu season, there were a total in North Carolina of 208 flu deaths that were reported. That was down from 391 deaths during the previous season. So like I said, there's a lot of variability based on the strain of flu that we see. Of those 208 deaths last year, 133 were people of age 65 and older, and 5 were under the age of 18. That's across our state. So we don't typically see very many deaths locally from flu, thank goodness. But nationally is where the thousands came from. It varies between 14,000 and 50,000 a year nationally, where we see death happen from flu. So since I got that data, I will send that to you as well so you can review that.
Thank you so much.
If I could I just add one thing in response to Mr. McKnight's question, and Ms. Harrison can speak more to this, but if you're interested, North Carolina DHHS publishes an ongoing updated website of COVID clusters that are connected to childcare or schools. And so you can look and see, right now I can see that there are 10 clusters that are associated. A cluster is, I believe, 5 or more cases that are associated with childcares across the state, with daycares. Only one with a school, because obviously schools are closed, but there's one cluster amongst school staff in Union County I can see. And there were that, you know, as some of them have resolved, they have come off the list.
Thank you.
And am I interpreting that correctly, Ms. Harrison?
Yes, and we will continue to see more, but that is the right place to locate them.
Ladies, if you all will get those to Ms. Henderson, we can get that sent to our board as soon as this meeting is over, please. Thank you so much.
Dr. McKnight, do you have any further questions or comments?
No, I'm good.
All right, thank you, sir. I'm going to defer my time till the end. And so, Mr. Peace, do you have questions or comments? Looks like he's muted, possibly. Okay, if that is corrected, we'll come back to him. Mr. Udy, do you have comments or questions?
I have one question and one concern. My question is, what avenues have the staff looked at to hire monitors for the bus drivers, and do we have the funds to support it if we go to Plan B?
No, sir, we don't currently have the funds in the district to pay for something like that. That is something we will need to discuss, request funds for. It is a conversation that was held just yesterday. We heard they did not want our bus drivers, if at all possible, doing anything but focusing on safely driving the children. And if there was any way to get monitors on buses, that was the conversation. So we're bringing this today only because it's not really hot off the press. Monitors have been in there, and some districts have been able to do it. We've not, but we bring it to you as an item for consideration, but the funding is not there for such. It is not in our budget. We don't currently have the money. It will need to be something we talk about. What was the first part of that, Mr. Udy, though?
I'm sorry?
What was the first part of that question?
Oh, just if you had looked at any avenues of where to hire monitors, and was there any money in the budget to support it?
Okay, yes, sir.
Okay. The concern I have with going to Plan C, the alternate plan there, is I don't want our younger kids to become latchkey kids where they're at home with no parental supervision. I think sometimes these younger kids, like pre-K through, say, 7th, would be safer at school than being at home by themselves locked in. So that's just a concern I have, but I do know that safety of all the kids comes first, and that's just a concern I have, is that we don't end up with a lot of latchkey kids. And that's all I have, Mr.
All right. Thank you, sir. I appreciate that. Dr. Houlihan, have you rejoined?
I have. Can you hear me okay?
I can. Yes, sir. Would you have questions or comments?
Yeah, I do. I've got a couple of questions. To me, there are at least 3 main things that we need to consider if we go to Plan C. And the first one to me is safety. And Lisa, are you still there? Is Lisa there?
Yes, sir, she is. Lisa Harrison is still with us.
Yeah. The question I've got in terms of safety is, can you tell us what the future direction predictions are for the county?
Oh, I wish I could. That would be a lovely thing to have a crystal ball of. I can tell you that we continue to see a steady rise. As you saw those curves when I was presenting, they're continuing to go up. So we get between 8 and 11 new cases in Granville County a day. I'm grateful that that rate is not doubling more frequently, but we definitely are still seeing an increase. And where we see the most need for our attention in public health and mitigation efforts is around outbreaks and clusters. And so it's really, I'm proud of our state for being as transparent as we've been with the data. And just like Mr. Boyson has mentioned, we do have all of that published online. But I continue to fear we will see increases for at least the next 3 months.
Okay, so you think it's going to continue to rise? Maybe not, maybe not like Florida, but it's going to continue to rise some. And to me, that is an important thing. I just hope that we're smart enough to figure out as best we can what the direction is and so forth. The second thing related to that is, and Dr. McLean, you and your staff may not have the answer to that right now, but it would be really interesting for you all to think through what are the metrics that will be used to determine whether or not a decision is made to go back to Plan B. I don't expect that right now. You don't even need to comment, but I think that would be very helpful. Actually, no matter what we do. The second thing that to me is important is equity. I know we've talked about this, and I am a little bit concerned about equity across the county ongoing. And if I'm not, I think I heard someone say that in places that don't have internet, that there would be package to pick up, and for parents and so forth to come and get them. I just throw out to you that if you, knowing this county like so many of us do, there may be a number of people, of kids who need it the most, whose parents may not have transportation. And I just think it's really important that if we go in that direction, we do not assume that everybody can do the kind of things that we think it can, and maybe that's something to think about. And then third, and you heard me at the academic committee meeting, I just throw out the one question, and that is, how do we know what we need to do to be successful? In other words, all of this stuff is new for all of us, but how do we know that what we need to do to be successful is in fact being done? So just throw those three out and look forward to the conversation.
All right.
Yeah.
So go ahead.
No, that's fine.
All right. Just want to check one more time. I know we're checking with Mr. Peace. Has he been able to come back yet? Okay. While we're waiting for that, just to make sure, I've got a couple questions. So back on the survey data, just to kind of understand, to go along with those percentages, Lauren, are you in a position to be able to kind of give us what those numbers look like? And what I mean by that is how many completed it versus how many are enrolled, how many completed it versus how many are employed? Is that something that you have readily available?
Yes, sir. Let me pull it back up. I'm sorry, I meant to share that when I went over the slides. So let's see, let me get back. Before the SAFE, we have had about 3,600 responses already, and we have about 3,200 people that have opened it and started it and haven't hit submit. So again, I'd say it's open until Sunday, July 26th, and if you've been waiting for this board meeting to help you make a decision, please go ahead and finish filling that out and hit submit. Because if everybody that's halfway done hit submit, then we are almost to our total number. We're about halfway there right now. So that's the students. Our teacher and employee survey, we had over a 90% response rate from our teachers, and staff overall, I believe it was about, it was a little less than 75%. So it was a pretty good response rate on that survey as well, but for teachers in particular, that was solid at around 90%.
Okay. So it's a question that's been answered, but I want to echo kind of my thought of it is talking about allowing families to be able to change their point of view, especially with the virtual. I definitely understand the reasoning, especially with the 4x4, the block scheduling for the high schools. I would definitely encourage us to look at the opportunity to be able to make that change, at least on a semester basis, instead of locking someone in for the whole year, because I think that may affect some of our options there. Just for my own knowledge, it may not even be important. Can somebody tell me what a 3 SEL signature is? That was in the presentation based off of mental health, I believe.
Yes, sir. So those are our 3 signature practices for social and emotional learning. And we use those practices, and this is what our staff is going to be learning about this fall. We use those practices when we're working with children and adults. In fact, I think, Mr. Richardson, you were in a presentation that I did earlier this year with some principals where you got to participate in some of those. So the 3 practices are, number 1 is a welcoming activity. So that brings everybody together and establishes a common purpose for what we're doing for the day. 2 is an engagement activity. And that's something our teachers are probably already most familiar with. That's something where students are working together and talking about content, but they're doing it in a way where they are communicating with their peers in a positive way. And the 3rd one is an optimistic closure, where you're really looking at, being thankful for and appreciating the folks that have come together with you that day, and reflecting on what you accomplished and doing some things to get excited to start again. So those are the 3 signature SEL practices, and we're going to embed those in our lessons, whether they're remote or face-to-face, to ensure that our students are having that time together to connect, but also it allows us to teach. I'm going to go a little bit in the weeds here, our 5 CASEL core competencies, which are the things we want our kids to learn to be successful. So if they're things like self-awareness, persistence, I'm going to not remember all 5 off the top of my head, so you will forgive me. But we use those as a way to teach the 5 competencies we want our students to learn.
Okay.
Social learning. I hope that answers
Thank you. It does, and I'm sorry that was not on my alphabet glossary sheet. So,
no problem.
My next thing is for Ms. Robinson and Dr. Myrick, the PD that you're rolling out, and I know I had a chance to talk to Ms. Robinson yesterday about it, and think we're really going at it well. My question is this PD going to be required? If so, how are we monitoring that? Because my follow-up thought to that is I want to make sure, obviously we're thrusting people into a learning environment they're not used to. Want to make sure that we kind of save them from themselves, if that makes sense. That just because you're a great teacher in the classroom, I don't want it to be an ego thing that we don't want to go to pursue PD because we don't think we need it. So my question is how are we making sure that PD is getting done?
That's a great question, and I think the answer to your question is yes, it's required, and yes, it's for choice. So there will be some elements for sure that are required. For example, the remote teaching and learning expectations for Granville County, that will be required for all teaching staff. And we will monitor the completion of that through our PD monitoring system of Wisdomware. So we will ensure that every teacher has had that course. So many of the courses that are up there, our teachers have already had. For example, setting up your virtual classroom. We had hundreds of teachers who went through those courses this spring out of necessity. So if someone has already set up, for example, their Google Classroom, then going to the Google Classroom course now is not necessary because you've already done the work. Then I think the other pieces are, you're right, because we want to help teachers see where do the skills and the strategies you have translate to that new environment and where do they not. And that's really that 4th piece of what are all the tools at your disposal. I'm not sure that pushing teachers through all those tools in one sitting is the best solution to that. It's more of as you need, let's go learn, which is how adults learn most effectively. So it's a little bit of required and some choice as well. Does that answer your question?
It does. Thank you. Dealing with exceptional children, EC, and I'm not sure if this is a Ms. Gorman question or Dr. McLean. So we saw on that slide that there will be contingency plans going along with the IEPs. My question is, with the amount of students that we have that are EC, how quickly are we going to be able to roll that out, put that in place, and get that in place for the student so that they don't fall through the cracks of, I'm still trying to get to it and we're halfway through the first semester?
Attorney Dubison, I know your firm did some nice training with EC directors across the state. And this has been one of those areas that's been challenging for everyone. But we want to make sure we're doing things right. We're going to continue working in this area. Will you sort of address that question for me on best practice here?
Absolutely. So, and I will say that one thing I would sort of amend from the slide is that there will be learning plans for EC students whose IEPs can't fully be implemented remotely as they're written. So some students' IEPs can be, some students are receiving speech therapy and could continue to receive that or something. So we would focus on the students for whom remote learning is the most different. And as far as how quickly that can happen, I would say it is unrealistic to expect every child to have had an IEP meeting before school starts. But I know that the department is sort of working on how to prioritize those and prioritize those students whose services, would be most impacted. And looking at, what those plans will say. Obviously, if we decide that it's not the right decision to come back into the building or to come back into the building full time, then what the team will be looking at is how to best reach that student, given their special needs and given that they cannot be in the building full time. That will be a given, but we'll be working on how to reach those students.
Okay. Along with that, are we giving flexibility to those people like speech therapists and those kind of things when they're delivering their service? Are we giving them the flexibility to just basically do what they've got to do to get that service implemented?
So is your question, can they provide services remotely?
That and like if they're seeing kids in groups and stuff like that, how is that working for them because of privacy concerns and those kind of things?
Mm-hmm. I don't know if Anika Gorm is still on, but if she is, I think she would definitely want to address that as well. I can say that legally, remote like teletherapy is permissible if that student's particular service need can be addressed remotely, and many of them can. And there's been a lot of, just across the state, successful remote provision of speech therapy, for instance. And certainly it is also permissible to provide special education services in small groups remotely. And we talk to teachers about how to, protect confidentiality as best they can in that setting. But obviously students get served in groups in school, and we can do that at home as well. So certainly I think teachers are learning to be creative in how to provide special education services. I know some special ed teachers, some students receive all of their special education services in the regular education classroom. And in fact, most of your special education students are in the regular education classroom most of the time. And so then the job of the special ed teacher becomes to work with the regular ed teachers to make sure that they are able to reach these students with their content and to modify it or to co-teach with them remotely. And I know that they were doing that in the spring as well. And does Ms. Gorm, do you want to add anything? Are you still there?
Attorney Judith, she has texted me and her mute will not unmute. She's getting a mute error on her computer, so she's not able to speak.
Okay. All right. Well, that's a shame. But so in any case, I hope that helps somewhat. I think if the answer is there flexibility in providing those services, yes, there is, and they do have to be creative. But certainly, if a student normally gets pulled out for some direct reading instruction in school, that can happen remotely. And I see Ms. Gorham is doing in the chat function that yes, there is flexibility.
Okay. Thank you for that. One last question for me. I'm assuming that we're going to attempt to do meal delivery, kind of what we did last school year. Can there be some thought given to the fact of trying to line that up somehow with packet pickup day? Because my thought is one question Dr. Houlihan said is just the challenge of transportation, that maybe not asking a family to come back to the school twice if they don't have to.
Absolutely. And that is what is so nice about being able to be a little more flexible when it comes to a modified plan or plan C. While it might be remote and we're in the process, or we may need to find work for people, there's plenty of work for people. We know we had challenges before, but this is an opportunity to correct some of those challenges. So we've discussed meal delivery, packet delivery, not just pickup, but some delivery. Now, we won't necessarily know who will need it until we get started or get going, but that is something we've already begun discussing, so absolutely. Dr. Winborn, would you like to add anything to that? Am I missing anything with that response?
No, ma'am. I would like the board to be aware that the state has requested a waiver so that the summer feeding can continue after August 31st, and that would allow the free meals to continue for all children. But we, regardless of what happens, we're going to be prepared to deliver meals.
This is Eva. Yeah, I'm sorry, Dr. Winborn.
Go ahead.
Well, I just wanted to add on to what Dr. Winborn is saying, that, you know, in the spring, the federal government granted several waivers of the normal meal rules. And one of them was this, to allow us to use this summer feeding program, which means you don't have to check everyone's eligibility before giving them a meal. You can be a lot more free in how you distribute meals. You obviously don't have to distribute them on site. You can drive them around the community. And a lot of those waivers expire either July or August, or the end of August. So certainly there is an effort to renew them, and I don't have any reason to think that they couldn't, but I don't know, and it hasn't happened. So I don't want there to be a promise out there that it will be exactly the same as it was in the spring. But certainly I know that the school district is going to utilize every flexibility that they can.
Yeah.
Thank you for that.
All right, and then I would just echo that whatever we can do for staff, children, and the quicker we can get an answer out there to them, because I know just that's a big concern for our staff, and just that child cares, those who can afford it are filling up, and those. But I appreciate the staff and Dr. McLean and the attorney looking into that, definitely, because that's a huge concern for us. So that's all of my questions and comments. Just want to check one more time. Mr. Peace, have you got any questions?
Mr. Chair, can you hear me?
I can. There you go. Welcome. Want to see what questions or comments you have. Mr. Peace? Well,
he is unmuted, but I don't see the little dots moving, so it may not be coming through.
Okay. Well, if he jumps on, then we'll kind of give him that opportunity.
Am I coming through now?
Yes, yes, you are. Go ahead.
Okay, thank you. I'm there. A couple of things I wanted to touch on was I've been concerned about whether what would come first when we were making our deliberation, the safety or the academics as it relates to children. And you know, my concern is that I want the system to do the best possible job in getting our children their academics. And I would like for a plan to be in place that ensured all students had access to it, either remotely or by paper material, and how we got it to them. So, and the other thing that I was concerned about is if we do Plan B modified, how can we afford to do it and keep kids safe? I haven't figured that out yet. I haven't figured out how we can do it safely. So one of the concerns that I have, and most of my concerns have been brought forth already. But the one that concerns me has to do with in-building face-to-face. And, you know, a lot of places that I've seen, they have plexiglass in a lot of places. And I don't think we've done any of that. I have planned to do any of that to keep the spread down. But at any rate, those are the things that concerns me, and it has to do with safety first. And secondly would be how we make sure that all of the students have an opportunity to be successful academically. Thank you, sir.
Yes, sir. Thank you. All right, board. So now we are at the point that we have asked our questions and made comments. So at this point, what I want to open the floor up is where are we at as far as bringing a motion? And then once that motion is on the floor, if we get a second, we will deliberate that motion. I want to make sure that we're kind of thinking through that. Again, we need to spend the time we need to spend, but we don't need to draw it out just to draw it out. So the options that are currently available to us, and Dr. McLean, correct me if I'm wrong. Actually, can we put the slide back up with the options to consider? Currently, we could stay with Plan B as is, or we have these options. I think they're working on it. There we go.
Mr. Chair, this is Lisa Harrison, and I just need to sign off and join another call here, but I want to let you know that the health department is here for the school system, and we will be with you through this journey no matter what you select. We're your partners, and we look forward to working with you throughout the journey ahead. So thank you for letting me be on to share data today, and reach out to me anytime with questions. I'm glad to answer them.
Yes, ma'am. Thank you, Ms. Harrison. We appreciate all you've done to support us thus far.
Thank you so much, Ms. Harrison.
Thank you for having me.
Okay. So board, the options. Yes, sir.
I would like to bring the motion.
Okay.
This is Danny.
All right.
I would like to make a motion to allow the superintendent the authority to start with that modified plan of C with an evaluation every 4.5 weeks, and to decide when it is safe to go into Plan B.
I second
the original
the motion.
Okay. All right. And that was a motion by Mr. Udy and a second by, was that Dr. Houlihan?
Yes.
All right. Let me read this back and make sure we have it correct. Mr. Udy made the motion, seconded by Dr. Houlihan, to give the superintendent the authority to have a modified Plan C, evaluating every 4.5 weeks, as to when it would be appropriate to move back into Plan B. Is that correct, Mr. Udy?
That is correct.
Okay. All right. So we have a motion and a second on the floor. And now is there discussion?
May I seek some clarification? I think on the presentation that may be called modified B.
Yeah, that was one point I wanted to get. What, Mr. Udy, are you saying modified Plan B, or are you modifying Plan C in some way?
No, it's the modified Plan B where it had Plan C with evaluation every 4.5 weeks.
Okay.
I go back. So I may not have wanted to second that motion. I thought you were talking about Plan C with the superintendent reassessing every 4 weeks. But you're talking about Plan B.
I think the confusion is just in the terminology. Maybe if we, instead of Plan B or C, we say remote instruction to begin with reassessing every 4.5 weeks. Is that what you mean?
Yes, that's what I mean.
Okay,
Yeah,
so
that's what I seconded. So that's good. Yes, thank you.
Okay.
So
Plan C is not modified.
Okay, yeah, let's reword this motion. The motion now is to start with remote instruction and reassessing every 4 weeks, giving the superintendent to go back to Plan B at her discretion based on the partnership with the health department. Is that what, Mr. Udy, you mean?
Yes.
And Dr. Houlihan, is that still good for you?
Yes.
All right. So now, if you have discussion.
I would like to make a point, please. This is Lynn.
Yes, Ms. Allred.
I don't feel comfortable making any decision until we get the rest of our surveys in. I feel like we gave the parents an opportunity to chime in and say what they would like for their families, and by making a decision today, and they have several more days to respond. And correct me if I'm wrong, we still have a lot more responses to come in. I just don't feel comfortable making that decision today.
Okay. So board, does other people have concerns about that? Ms. Allred, do you want to make a motion to that effect? Ms. Dubison, you're going to have to help me navigate this
I
part.
think there's already a motion on the floor, so that one needs to be voted on. So I think, before any other motions were made. And I would want to clarify from Ms. Curtis and the staff, is there reason to think that more survey results are coming? Certainly many people didn't answer it, but is it required?
We are asking for a response from all people so we know what learning option they are choosing. I think it's important to remember this is not a survey. We did surveys earlier this summer to find out what people were thinking about, what learning options they were most interested in at the time. But this is signing up for your individual child. This is not an anonymous survey like we did earlier. We do have about half of the responses in. People do have through Sunday to complete it.
Okay.
Mr. Chairman, I have a point of clarification.
Yes, sir.
At the end of 4 weeks, how will the superintendent decide, and who will she notify the board of her decision to change if she decides to do that?
Okay. Dr. McLean, can you speak to the thought process of how that'll be decided and then how we will communicate that?
Absolutely.
4 weeks is a relatively short period of time, really.
Right. One of the things we had talked about doing was with the health department, probably around week 3, begin reassessing Mr. Peace. And then determining, getting a presentation with you all where we are with the health department, what conditions look like in the school, have we gotten additional guidance into questions we've asked at the state level, things of that nature would probably be the things that come to mind, at least right now for us. Can we share with the board, call a meeting, let you know what we know? Is that enough? To make a different decision or to continue on the path we're on? Those are the things that sort of have come to mind at this point. I don't know that we need to do a full reassessment because people will have selected where they are. For us, it's the safety. It really is the safety. Are we in a position at that point to make a different decision? So we'd like to begin looking week 3 and call a meeting around week 4. And in consultation with the health department and our board, sort of make a recommendation. Well, consultation with the health department, make a recommendation, or at least have a conversation with our board, what you think we ought to do. Giving parents notice, probably we want to talk about what that type of notice looks like to our community, because it doesn't need to be.
No. That wasn't in the motion, so I just wanted to make sure that we as a board knew what the assessment was going to be, or what you were thinking about doing at that time.
Okay.
That's all.
Yes,
Thank
sir.
you.
Yes, sir.
Ms. Allred, does that help your thought any as far as kind of where we are is if we go with either one of these options, we are doing remote, one just kind of spells out the staggering a little different. Does that help you any, or does that still remain as a concern to you?
To be honest, I'm not real sure. I'm just looking at the numbers of the learning options that were chosen, and they're kind of neck and neck right now. Yeah, I guess so. Thank you.
Okay. What other comments do you have, board?
I have a question real quick about with Plan C. Is there a possibility, I don't know if it's just built into the superintendent's authority, but would there be an opportunity to do some type of staggered entry for those certain populations, maybe at least 1 week or 2 weeks before we decide it's safe to go back in, just so that we're not pushing everybody back in at the same time. It kind of gives the district a chance to ramp up slowly and bring in some folk before we say, hey, this is full on, kids are coming back. So it's just taking a little piece of that modified plan B and just saying, hey, we would like to stick this in the plan C. So whenever it's safe to go back, we'll slowly ramp up. Is that a possibility to work that in there, or is that just one of those authorities that's given to the superintendent under Plan C?
I'll be happy to work that in, Dr. McKnight, and get something to the board.
Okay. All right. Other comments or questions, board?
Ms. Chair, I have some comments.
Mr. Rivers?
Go ahead, Lynn.
Oh.
If Ms. Orr, if she's not finished, she can go ahead and finish.
No, I just had one more question. And I apologize. If we go to Plan B, do we have enough teachers based on the responses that we have now as to the number of students that we're looking at? Do we have enough teachers to teach the students that want to go back under Plan B?
Dr. Winborn and Mr. Perry, do we have any information at this point?
Yeah, that's a good question. Basically, the only hard information we have is from the teacher survey. Mr. Perry and his staff have prepared a process that teachers can officially request leave and or workplace modifications. But we don't have hard, definite numbers yet on which and how many teachers would not be reporting to work. So really the only thing we have to look at this moment is the slide, and Ms. Curtis, if you can go to it, that shows the numbers that felt comfortable or not comfortable reporting back to work right there. So, looks like almost 2/3 are either somewhat or extremely uncomfortable reporting back to work. So the question that you're asking is a very good one, because we could certainly plan to have the children come back, but if we did not have the staff who physically reported to work, we would be in a difficult position.
Okay, thank you.
I'm sorry, Mr. Rivers, you had questions now?
Yes, I did. I had some comments. I'll begin with the inputs I've gotten from District 3. 100% of the phone calls, and there have been a number of them, and emails I have received from District 3 have been 100% have been for opening the schools under Plan B. As all of you all have done, I'm sure, I've spent the past several months really diving into as much data, and that's the kind of guy I am. I'm a real data person. I've been diving into the data, trying to understand what's going on, and it's been very difficult. The news media board has really put out a lot of bad information, and I think has led to a lot of misunderstanding about what's going on. All I can tell you is what I have found, and I have stayed away from going to news outlets. I've tried to go directly to websites for states and their departments of health. Texas is a very interesting one. Texas was recently declared a hotspot. There were false stories that came out that their hospitals were all full and crowded. It turns out they were all full doing elective surgeries that had been postponed for 4 months. Their COVID population statewide never exceeded 8%. Of their hospital beds. It was reported that Houston, all their hospital beds were full. Yesterday, the official from Houston came out and said there were 2,500 empty hospital beds in Houston. There've just been a lot of misinformation. The facts, indicate from Texas, and you have to dig through a lot of their website pages and a lot of PDFs. But the seasonal flu in 2017-18 resulted in 11,000 Texans succumbing. In 18-19, 10,000 passed away. The total deaths in Texas so far from COVID are 4,000. But what's more critical is to look at the mortality rates. In Texas, the mortality rate from the seasonal flu is anywhere from 3, depending on the year, 3 to 4 times higher than for COVID-19. However, you got to consider that the COVID death toll in America is pretty much assuredly inflated. You can go back to a press conference at the beginning of the week in Illinois, where the Illinois representative from their Department of Public Health, when cornered by a reporter, stated that no matter how you die, and she said, and I quote, if you fall off a cliff and bash your brains out, but you test positive for an antibody, your serology test post-mortem shows that you have a COVID antibody, which means you were exposed at some point, it's a COVID death. Quite likely, we have not suffered the 130 plus thousand deaths that we are saying we've suffered from COVID, which means our mortality goes down, our mortality rate goes down even less. Yesterday, Center for Disease Control expressed their belief that the actual infections in the United States are well over 10 times what the testing has shown. We have completed in America over 50 million tests. We have 4.5 or so, 4.7 million cases that have resulted from those tests, positive test cases. CDC thinks it's more likely we have somewhere around 45 to 50 million infected people or who have been infected in the past 5 months. So that further lowers the mortality rate. The point I'm trying to make is all the data that I've seen and looked at, staying away from the news media, but looking at hard data from states and the departments of public health, indicates that the likelihood of mortality from COVID-19 is far less from the seasonal flu. There have been numerous studies, and Dr. McKnight, you asked, one of the studies is not scientific, but one of the first studies that came out was in May, when New York City Department of Public Health released a statement that during the crisis, when they were ramping up all their healthcare providers, they asked the YMCA to provide childcare for 30,000 children of healthcare workers. For 6 weeks, those 30,000 children were kept in close proximity without masks, without anything else. One child tested positive for COVID-19. The studies from South Korea that were referenced earlier this week by the CDC, studies that came out, I think, the week before in Ireland and Iceland, all indicated a very infrequent transmission of COVID-19 from children to adults and from children to children. What all this means to me is that the risk is not what we tend to believe it is. The CDC yesterday stated that the median age for mortality from COVID-19 in the United States was 78 years old. That means that half of the deaths that we have, whatever that number actually is, half of the deaths are occurring in less than 1% of the population, those people 78 years of age and older. That means that for the rest of us, the mortality rate is even far lower. So if you look at the raw numbers and compare mortality to seasonal flu, then you figure out the death toll has been inflated. Then you figure out that the 50% of those who have succumbed were 78 years and older. You find out the death rate is substantially lower than seasonal flu. In Granville County, we've had roughly 560 community spread cases. You can't count the prison, at least I don't in my calculus, because the prison is a self-contained unit that's not part of Granville County, it's federal. 560 cases, we've had 3 deaths, 3 fatalities, sadly. We have 60,000 people in Granville County. Of those 560 cases, over 425 have been resolved, recovered, they're out of isolation, they're living their normal lives. All of this tells me that the damage that's going to be done by not having face-to-face instruction, in my opinion, and I certainly respect all of your opinions, and I respect the fact that we do not want to put our children or our staff in any danger. But the risk we run from not doing face-to-face education far outweighs the risk from any serious result from a COVID-19 exposure. We have looked at reports from American Society of Pediatrics that is encouraging schools to open. Report came out in June that stated that they believe that as a result of the isolation from the past spring, that as many as 30% of our children, and probably more, were suffering depression. We have families that are in crisis because of this situation. I am very, very concerned that if we try to do remote learning, and I want to applaud all of our teachers and our administration for the outstanding job we in Granville County Schools did in rolling out remote learning as rapidly as we did this spring. But the fact of the matter is, the data we saw from Dr. Myrick in May and June indicated substantial, as many as 45% of our children did not participate with their devices in education. A middle school teacher told me that of the 110 students that she was teaching remotely this spring, on average, only 12 actually logged in to the Zoom meetings and actually did their work. I know from experience with my children on online classes, if you take an online class, you need to have parental support and family support, and you need to have a motivated student. You volunteer to take an online course because you need it to complete a graduation requirement or to get into college, and therefore you want to take it, and therefore you put in the effort. As I told Dr. Myrick earlier in the meeting, 4 hours for AP Chemistry or AP US History a week is not enough. It won't work. We know that our younger children, especially our third graders and our second graders who are trying to teach to read, we know this won't work. So I implore, and I really hope we consider this carefully. I really believe the risks of not going to face-to-face education are far outweigh the risks of going to face-to-face. So I would hope the board would carefully consider what we do here. If we start out remote, I think it's going to be hard to switch back to face-to-face. And I worry that we may lose a significant portion this school year, and we lost a significant portion of educating our children last school year. So I will vote no on this motion.
Okay. Any further discussion before we call for a vote?
Yeah, Tom, I want to speak a little bit at what Rob just said. And Rob, you did a great job of sharing your information. One of the things that I want to mention in terms of what you talked about, with people dying and so forth in the flu and so on and so forth. I think one of the things that is missing in what you shared, and at least is important to me, is that you ask a lot of doctors and they'll tell you, we really don't know where this is going. That it's been 6 months that we've had this COVID, and that doctors don't know any more than anybody else what's going to happen. First, it started in the lungs, and then it moved, to different organs and so forth. And my concern is, because we have not shown in North Carolina a stream of going down. The concern that I have is that we just don't know where this thing is going. And if it's clearly going in the wrong direction right now, I would rather weigh on the side of caution as opposed to comparing it to the flu and all those other things. I would agree with you that face-to-face is much more helpful than what we're talking about. And that's why if this is addressed by Dr. McLean every 4 weeks, or whatever, 4.5, whatever the motion was, I feel comfortable that as we move on, if things change in terms of the direction, I'd be the first one to support going back to person to person. And then the last thing I want to mention is this, and that is, if you look at the data about surveys of employees and teachers, and see how that data has changed over the last few months. I think what you'll see is if you've got, I can't see the bottom of it here. If you've got a number of teachers, they're 72% at one, if we have a number of teachers who are not going to come to school and going to work because they have these different conditions and so on and so forth, what do we do about that? How do we tell them they can't do that? I mean, that whole thing with employees and with teachers is a major source of concern, and I don't know how we resolve it. I'm through.
If I could comment, Dr. Quillen, you made some great points, and I agree with the staffing issue is going to be a challenge. And you are right, we do not know where this is headed. The main thing that's influenced me is I don't think it's going away. It is a very contagious, but the data is showing not a very deadly virus. My guess is that based on the serology testing they did in New York back in April and early May, they determined that their guess was that at that time, this was in early May, that as much as 30% of the population in the state of New York had the virus and either had mild symptoms or no symptoms or serious symptoms. It spreads very rapidly. Likely, CDC is saying that 50 million Americans have had it now. Likely, I think a lot more. I just don't think it's going to go away anytime soon. But the fact that it only affects only substantially affects a small portion of our population that we can protect. I think that's, to me, is what's convincing me that we need to move forward. Obviously with the caveat that if things change, if we see outbreaks in our schools, if we see people getting sick, then we're going to have to obviously change gears. The other thing that I would like to mention is we have provided our parents with an option to choose remote learning on their own, regardless of the governor's recommendation for Plan B. And also, I'll say the Governor Cooper and his staff recommended Plan B. So that should carry some weight. But those parents who do have concerns or have multi-generational families with at-risk people at home, I applaud Dr. McLean and her staff for having the SAFE program and these different options. They do have the option to choose remote learning. So those parents, and it seems to be about 50-50, those parents who really want their children to get face-to-face instruction should have an option as well. And finally, my last comment will be, we're going to see an achievement gap, in my opinion, not based on ethnicity. We're going to see an achievement gap based on home environment and parental support and student motivation. Those students who really want to apply themselves to remote learning in an environment that's conducive to remote learning will do far better than those students who are disengaged, who are unmotivated, or who have a very complex and difficult home situation. And that is, to me, is just very, very sad. And I think we're going to see a big disparity in performance based on, the luck of the draw for these children who are in bad circumstances. Thank you so much.
Rod, let me talk again with you and everybody. I think you made some great points. I really do. And I think that none of us are satisfied or pleased with remote instruction. I don't think any of us are. It's everything you said and more. And I understand that. And once again, come back to Dr. McLean checking it out. But the thing I'm also really concerned with is if you look at the data, I wonder what percent of our teachers have a pre-existing condition, and how does that impact whether or not they can come back or will come back or should come back to the classroom. I mean, that is a serious issue. And of course, that's true no matter what we do. But I think I just worry significantly about what our teachers will do. And it also makes you wonder how many of them we would lose if they can go to other school systems like Wake or Durham, who are doing remote instruction, and how that would impact the quality of our staffing. I really do understand where you're coming from, and I don't disagree one bit. I just think erring on the side of caution right now, to me, is the way to go.
Okay. Further comments before we vote? All right. Hearing none, if you're ready to vote, again, I want to read this motion to you to make sure I'm correct. Mr. Udy made a motion, Dr. Houlihan seconded, that we would start with remote instruction, assessing every 4 weeks, and giving the superintendent the authority to make modifications of that in consultation with the health department and informing the board. So essentially, if I'm correct, that is a plan C with the option to go to a plan B at those intervals. Am I correct on that, Mr. Udy?
Yes, whatever the way the attorney put it out is the correct way. Yes.
Okay. All right. Do you agree with that, Attorney Dubison?
Yes.
Okay.
My understanding is that the board authorizes the superintendent to move towards reentry in consultation with the health department as deemed safe, reassessing every 4 weeks. Is that your understanding, Dr. McLean?
That is.
Okay.
All right. So if you are in favor of this, you will vote yes. If you are not in favor of this, you will vote no. This will require a majority vote. And so we will do a roll call. Ms. Allred?
My heart and my head are telling me two different things. I'm going to say no.
Okay. Mr. Rivers?
No.
Dr. McKnight?
Yes.
Mr. Peace?
Yes.
Mr. Udy?
Yes.
Dr. Houlihan?
Yes.
All right, so that passes 5-2. And so we will now advertise that as our plan of reentry. And we will ask the superintendent, she's been given that authority there to be able to make those moves. Are there other motions that need to be made related to reentry? Okay. Dr. McLean, do you have anything further with reentry?
No, sir, not at this time. The staff and I will get busy. Thank you all so very much for your work this evening. As I said, that I've never seen days like this, and I know this was difficult. This was difficult, and I wish there were easy answers. There haven't been for any of us, but I definitely thank you, and we promise to keep everyone informed to the very best of our abilities. Thank you so much, Chair and Board.
Yes, ma'am. So, Board, I do thank you for your time and your effort today. I know that there will probably be questions you'll be getting over the next couple days. Again, feel free to direct those to the superintendent's office so that we can get good, clear information out. And as they come up with the answers to some of the questions and concerns we've posed today, they will get that information out as well. Board members, I do want to remind you, we do have 2 meetings in August scheduled right now. Currently, we have our next board meeting, which is August 3rd. We also have a board training August 24th The thought would be to add the retreat topics before that training, but we are still working to work that out. I do need to let you know that because we have made the decision to move virtual or remain virtual for our schools, we will remain virtual for our meetings. So August 3rd will be a virtual meeting. And so just make sure you mark your calendar and be watching for that information to come out. Is there anything further from our board members today? All right, Dr. McLean, anything further from you or your staff?
No, sir, Mr. Chair. Thank you.
All right. May I have a motion to adjourn?
Motion to adjourn.
All right, we have a motion by Dr. McKnight, a second by who is that?
Mr. Udy.
Udy. All right, we will vote on that now. Ms. Allred?
Yes.
Mr. Rivers?
Yes.
Dr. McKnight?
Yes.
Mr. Peace?
Yes.
Mr. Udy?
Yes.
Dr. Houlihan?
Yes.
All right, that's a 7-0 vote to adjourn, and so we are now adjourned. I hope everybody has a great afternoon. And again, staff and those that worked on this, thank you for that.